A lovely day, and I have my beautiful sister Shikiola with me. I woke up and I came to the studio and I was very happy because I saw you.
Oh, really?
Yes, because a lot of times people sleep, they don't wake up.
Of
And when they actually do wake up, you find out that either one hand is gone or a part of the body is gone, one thing or the other. And the funniest part of it is that they never anticipated it when they went to bed.
You know, we're in an era where people just slump and die. And that is why it's really important to maintain a healthy lifestyle. And, for those of us doing this kind of job, we must really take care of our health to remain healthy at all times. Good morning, Nigerians.
Yes, good morning. It is Weekend Deal and the show is just starting. We're taking a look at the silent killers, the whatever you want to call it, sudden death, coronary heart, whatever it is. We're looking at all of that this weekend because the focus is to ensure that we maintain a healthy lifestyle. We don't want to lose anybody, and particularly my sister here and I do not want to lose you, because if you're not there, you will not brighten our day for Weekend Deal.
Actually, it's been a rainy day in Abuja. In fact, I should call it a raining week because it's been raining all the week. And there's no better time to talk about healthy lifestyle than a beautiful day like this. Yeah, thank you very much for being there. And if you just joined us, you're on to Weekend Deal on the network service of the NTA. The discussion has been the silent killers. Many people walk about, they believe they're actually fine, they believe they're doing well, but they're not. And statistics shows that there are 1.28 billion people world over living with hypertension, and the alarming fact is that they do not even know that they have the disease. And I check it often. I actually do.
When last did you check?
I can't remember at this moment. Okay, let's quickly get to this background report by Francis Ogbe that sets the tone for discussion. And we just have that background report before we get down to discussion on the silent killers.
It is gradually becoming a norm in Nigeria to hear the news of men, women, the young and the elderly who suddenly slumped and died without any prior or visible sign of illness. Could this be as a result of one of the silent killer diseases?
Well, silent killer diseases are medical and surgical diseases that kill people unknowingly. Here we mean that patients may have this disease without knowing that they have them. And oftentimes the patient would present to the hospital with complications arising from these disorders.
Heart disease, hypertension and diabetes are known to be the major silent killer diseases. According to World Health Organization, 1.28 billion adults aged 30 to 79 years worldwide have hypertension.
Hypertension is a silent killer disease because most people who have hypertension do not present with symptoms. We've had instances where individuals will walk in, present the first time to the emergency department with strokes or acute coronary syndrome, or what we call a heart attack, or kidney failure arising from long-standing hypertension that they don't know that they have. The risk factors for hypertension include older age group, people who are of African descent at increased risk of hypertension, Those who have family history of hypertension, whose siblings or parents have hypertension, are also at increased risk of hypertension. Those who don't exercise are prone to hypertension. Those who take a lot of salt, like you have in the environment, are also prone to hypertension, as well as those who are obese are also at increased risk of hypertension. Others include what people refer to as heart attack, but we use the word myocardial infarction, where the blood supply to the heart suddenly gets cut off, and then the individual heart cannot function properly, and the person, if not properly treated, he or she may lose their life.
Beside heart disease, hypertension and diabetes, there are other lesser-known silent killer diseases. Because of the prevalence of silent killer diseases, citizens are advised to go for medical checkup at least twice a year, even when they feel very healthy.
Medical checkup is not something most Nigerians take seriously. Again, this may stem from the social cultural belief around health and health-related issues. Regular health checkup, it's very important to help to mitigate the development of both silent medical conditions as well as silent cancers that can lead to death. And also, it would help to prevent the risk of developing sudden death, because some of the risk factors that can lead to sudden death can be picked up during medical checkup, and then such things can be addressed. It's advised that people should have an annual medical checkup. But the type of annual medical checkup also depends on the age of the individual, the kind of work the person does, as well as the gender of the patient.
Following a good diet, maintaining a healthy routine, and investing in wholesome lifestyle practices cannot be overstated.
A healthy diet makes someone a healthy individual, meaning that if we learn early to eat right, the risk of developing chronic medical conditions such as hypertension and diabetes can be reduced significantly. Poor feeding habits can lead to development of obesity. Obesity is a risk factor for hypertension, for diabetes, joint disorders, as well as cancers. So healthy eating is very important. It's a sine qua non for prevention of chronic medical conditions that can predispose to sudden death. Exercise helps to reduce the risk of hypertension, helps to reduce the risk of diabetes. Of course, it also helps to reduce, it's one of the measures that is taken to reduce weight, that's obesity.
There are many people who walk around believing they are healthy, but they are not. Therefore, our focus on Weekend Deal today will be on silent killer diseases.
Okay, thank you for being there. And now we look at another feature on cardiomyopathy, another killer disease. So let's quickly look at that by rate 1.
Rising. It does seem as though many are not taking note. There may be no accurate figures at hand. Still, experts have it that major contributors to out-of-hospital medical deaths are silent killer diseases. Yes, the silent killer.
That term silent killer is usually referred to hypertension. The reason is because most of these heart diseases you hear about, the underlying thing is hypertension. Meanwhile, the person who is suffering from hypertension does not know that he is suffering from any ill health. He's fine, he's moving around. But as his blood pressure is higher than normal, it's affecting practically all organs of the body.
It creeps in. You won't have the slightest idea that they are after you. And it's just a matter of time. And then, one day, you realize that the disease has crept in and taken hold of your body. Unfortunately for some, it might just be too late. The number of people who suddenly die without explanation is increasingly alarming, and it's not uncommon to see and hear a lot about heart issues.
Cardiomyopathies are a group of heart muscles disease that affect the heart muscles basically, and they can either be a primary cardiomyopathy with an unknown cause, or could be secondary, which is as a result of other systemic diseases.
It is important to identify people who may be at high risk for cardiomyopathy, since research shows that some people with cardiomyopathy do not notice obvious signs or symptoms, while others may notice some changes much later.
In some cases, what causes cardiomyopathy are not known, but in other cases, there are known causes. The reason why a patient will develop cardiomyopathy. For instance, somebody with who has suffered viral infection, someone who has uncontrolled blood pressure, hypertension. So these are different things that can lead to the heart to be dilated. And when it is dilated, that individual will begin to come down with symptoms of heart failure, which may include difficulty in breathing after doing some small walking, trying to walk from here to the gate. The patient have to rest, finding it difficult to lie down at night, because of getting choked up, having the body swollen everywhere, the legs swollen, coughing, and bringing out plenty sputum. Those are some of the features you see in people who are already developing heart failure as a result of cardiomyopathy.
Research shows that for some who have cardiomyopathy and show no signs, treatment may not be required. Sometimes dilated cardiomyopathy that comes on suddenly may go away quietly, while in other instances, treatment is required and necessary.
All the conditions that can give high blood pressure, all the conditions that can worsen your diabetic has to be addressed, have to be controlled. If you have high cholesterol, bad cholesterol, it has to be controlled. Okay, regular exercise is also very important. Then also reduction in salt intake, because all these things are what work hand in hand to make sure that the pressure go up, to make sure that the heart is weakened.
As the saying goes, your health account, your bank account are the same thing. The more you put in, the more you can take out.
Okay, your bank accounts, your health accounts, they are the same. Okay, that's something I just heard for the first time. But I have a guest who will help me clear on that, if they actually are the same, or maybe one is higher than the other. And my guest is none other than the consultant cardiologist in National Hospital, and his name is Dr. Oladipo Fashion. Nice to have you.
Thank you for having me.
Are you carrying syringe?
Well,
okay.
Today is not about syringes
and
and needles.
It's not about all the.
Yes.
And so I'm comfortable. Let me relax then and chat with you. Now, the last clip we saw talked about health, accounts and bank accounts, and I'm not sure. I've also heard the other way around. Your health is your wealth.
Yeah.
Which how does it play?
Well, just I think a simple answer for me is that, even more importantly, your health is more important than your bank account, because there are instances where your bank account might be fat and sometimes you can't do anything again. It's too late. So, in medicine, we always say that prevention is always better than cure. And in cardiovascular disease, this is very, very, very important. Nobody wants to have a stroke, nobody wants to have a heart attack before it's dealt with. The whole concept is to prevent. Nobody should have a heart failure, for instance. The whole idea is to prevent. Because once those things happen, they carry with them a huge body of disease that leads to death if nothing is done. Even if something is done, the risk of death is still quite high. And that's why we talk about sudden death in those situations.
All right, it's good you clear us on that, because even if I'm broke, I should in the bank, I shouldn't be broke with my health.
In fact, I tell my patients sometimes that if you have enough money for your medication or for eating, go and buy your medications, because people fast for days and nights and they don't die. But if you don't take your medications for a short period, something can go wrong.
But you also tell us when we're taking our medications, we must take it with food.
Okay, so that's a concept that grew from the years back. It's not totally true. In fact, most drugs are better taken on empty stomach.
Oh, wow.
Some drugs, yes, you must eat, but most drugs really better taken. We always advise take on empty stomach so that absorbability is increased. So
Okay.
that, there is no interaction with the food and the drug, between the food and the drug, the medication that you take.
All right. I'm wondering, you have hit us where it hurts most. Is we should do constant checks, even though it doesn't come that expensive. Nigerians will tell you checking is expensive. With the regards to our health, is the check really that expensive? What are the basic things we should be checking?
Okay, thank you. Again, I think this is another misconception. For instance, when we say check, it could be as easy as just checking your blood pressure. Is that expensive?
She hasn't checked since 1 week.
I don't think that's too bad.
No, I check regularly. Don't mind lazy.
So checking blood pressure, for instance, is not expensive. There's nothing to it. And the basic test, because when we say people should check, we are not asking that people should check every week, every month. A lot of times, once a year is even enough.
Oh.
Yes, it's only if we find an abnormality that the doctor can now request you or require you to do some other test relatively faster, at a shorter interval. But mostly for basic routine medical screening, usually once a year.
Okay, and the BP checks is also part of the cardio, means of detecting cardio challenges.
Sure, because there's a big deal about high blood pressure, hypertension, because it's a big problem in blacks. In Nigerians also, it's also a big problem because now we know that on the average, a third of Nigerians are hypertensive. That's
a third of Nigerians.
Yes, that's those that we even know. And we know that in blacks, Nigerians inclusive, high blood pressure tend to occur at an earlier age compared to whites. And we also know that when it happens with more vigor. I mean, there are higher chances of causing more havoc in blacks, Nigerians inclusive. So if we know this, we know that it comes vigorously, it comes much earlier in life, and a third of Nigerians are hypertensive that we know, that those that we don't even know, then it means that most of the causes of the sudden cardiac death we talk about are related to hypertension, really. Strokes, heart attacks, heart failure, and all that are related to hypertension. So hypertension is a major risk factor we need to deal with. Now, if that is the case, it means just checking blood pressure will go a long way in reducing cardiovascular problems in Nigeria. Just checking blood pressure. There are other risk factors which probably we'll talk about later, but I'm just trying to drive home the relevance of high blood pressure as the hub in a rim with spokes related to all these sudden deaths.
Other things, yes. And Shike, you were going to show something about high blood pressure.
We're still talking about silent killers. I was thinking the doctor will first of all tell us what those silent killers are, at least to reel them out. But one of them is high blood pressure, and in this feature by Enel Noble, after which you will tell us many of those silent killers. Enel Noble will tell us about high blood pressure. So the discussion will continue after that.
Being healthy is a necessity, and doing the needful to achieve good health is of great importance for all. Some experts are of the opinion that of all the silent killer diseases, high blood pressure probably takes one of the top 3.
Most of the hypertension that we see in the hospitals are called essential hypertension, and that is about 99.1% of those kind of hypertension cases. Now, what they call secondary hypertension, which is about less than 0.1% or to 1%. Secondary hypertension can be cured, but essential hypertension, we usually tell them the medication may be for life.
High blood pressure is a cardiovascular disease that has little or no regard for status, gender, color, race, or age. It is silent indeed, and it creeps upon many. If they are not vigilant, some symptoms may go unnoticed.
We can have headache, we can have fainting, we can have blood vision, we can have palpitations, the person is aware of his heartbeat. We can have lightheadedness for some people. For some people, they can tell you they have chest pain. Yeah, some people they can tell you that they have leg swelling. There are ranges that we use to like define the levels of blood pressure. The levels of blood pressure. We have the normal range. For the normal range starts from 110/70, and we pegged it at 120/80 as the minimum for the normal range. And then we have what they call pre-hypertension. It starts off from 121, it ends at 139. And then for the one at the bottom, which is the diastolic blood pressure, the takeoff point for the pre-hypertension is 81. Then the cutoff is 89. Then 140, 90 and above is hypertension.
High blood pressure can be generic. Still, there are some exceptions to the rule. It is quite alarming to note that in Nigeria alone, about 1.5 million between the ages of 22 and 23 suffer from high blood pressure. And that is not even counting those who are unaware or undiagnosed.
There are some things that causes it. Kidney problem can cause it. Pregnancy can cause it. Addison disease, some adrenal organs disorder can cause it. Now, when you see it present in a child like that, what we do in the hospitals is to do investigations around the kidney to see whether the kidney are compromised in one way or the other. We do a scan, we run the person through kidney function test. When we're able to establish that it's the kidney causing this hypertension at this early, then we're going to address the kidney problem, and then we see the blood pressure coming back normal. We know the risk factors. Try to avoid them. If it's alcohol, if it's smoking, if it's taking excessive salt consumption, if it's eating junks, if it's sedentary lifestyle, all those risk factors that can lead to hypertension, try to avoid it. And we also advise them to on compliance. Take your medications always as at when due.
High blood pressure is not a death sentence. It is treatable. It is manageable and controllable.
All right, it is not a death sentence. It is manageable, controllable if you actually run into the corridors of having one, or expose yourself to it. Well, I know that the doctor is still here with us, Dr. Oladipo, and Shike, you wanted to find out something earlier before we took that.
I just want him to tell us. Okay, we've seen high blood pressure as one of the silent killers. Let him just tell us some of the other silent killers that we have around us.
Okay, well, generally, cardiovascular diseases, people could harbor them for a while without symptoms. And that's why they are actually called silent killers. So like someone had alluded to, diabetes for instance, sugar could be high for a period, for years actually, without showing symptoms. And it's only when the value of the blood sugar starts going beyond a certain extent that people might now notice that they start urinating more frequently, the volume of urine increases, they get more thirsty, they might start losing weight. That is that. But a lot of people have some level of high sugar for a long time without knowing it. The same thing with high blood pressure. People could have high blood pressure for a long time without any symptoms. And I have to say this, hypertension does not have a symptom that can be ascribed to it. Because oftentimes we hear people say that when they have headache is when they know they're hypertensive. You can have headache and your BP is not high. And people have come up with values over 180, 200 and they had no headache whatsoever. So one cannot count on symptoms to determine if blood pressure is high or not.
So the basic thing is to constantly check. Now, yes. I'd like to know, at what age should we begin to check more frequently? And when I say frequently, what's the time lapse for frequency to check our BP and sugar, for instance?
Okay, well, that age is in two phases.
Okay.
If you have a strong family history, let's say, for
okay.
instance, one's parents, father, mother, or both, are hypertensive, and they became hypertensive at an age much lower than 50, the chances of the offsprings becoming hypertensive is high. So such people should start early in life.
When you say early, what does early mean?
Live healthy.
Like 30 years?
Even before then.
Oh.
In their 20s, they should start checking. I've seen a number of patients who become hypertensive from their 20s.
Wow.
Yeah. So the earlier, the better. And for general population, once you start hitting your 30, 35, you should check more regularly.
I want to know what more regularly is. Is it every month, every week?
Yeah. So normally, if there are no issues, no risk factors and other things, you can just check once or twice a year. So maybe every 6 months you check, or every year. And if the BP remains stable, you continue like that. But any time the blood pressure is found to be elevated, then you have to check more frequently. And that will come down to once in 3 months, or once in every month, or even depending on the severity of the blood pressure, once a week, or more than even once a week. There are times we require a patient to do every day for a short period, because we want to understand the pattern of the blood pressure in that patient. And when we then understand the pattern and we start medication, we can then ask the patient to do once a month or once a week, or depending. And ask that. But if you do the first time and there is no sign of high blood pressure, maybe another 6 months, you can do again. But usually no more than twice a year should be okay, except there's a problem.
Okay, now you have said, and I think I've also heard from other corridors, that there are usually no symptoms a lot of times, especially when we are younger. We just find ourselves, and that's it. I would like to know, really, I want to believe that there are certain symptoms the body might tell us, like you've come back from work, you didn't even do that much, you're stressed, I don't know. What should I be looking at? Assuming maybe I pin my body to look at stress, I may not find one, but there could be a reaction in my body that thing telling me you should see a doctor, or at least see someone to check you.
So what we preach in cardiovascular medicine is not to wait for any reaction.
Okay.
Because there is no reaction that is sine qua non, that is pathognomonic, that is characteristic of any of this, of hypertension, for instance. No. For heart attacks, some patients can have chest pain, for what we call coronary artery disease, actually. Some patients can have chest pain, but this chest pain usually is typical. It is usually associated with exertion, anger, increased anxiety. Anything that will make your heart rate go up and pump faster can now cause that chest pain.
Including exercise?
Yes, exercise, exertion. And it's often transient, maybe 5 to 10 minutes, because most times it will make the person stop doing what they're doing. And when they stop that process, in another 5-10 minutes, it fizzles out.
Okay.
So when it happens like that, and you can predict it again because it becomes repetitive. Every time you embark on similar activity of similar intensity, that same pattern of pain will happen. Then it's important.
Okay.
If you get angry, pain. Every time you get angry, pain is important. If you exercise, pain. You stop, it goes down. You exercise again, pain. You stop, it goes down. That kind of pain is important. Go and see your doctor.
Okay, pain is different from palpitation.
Yes, I'll explain that.
Okay.
So that is one, and that is important for people who might be susceptible to having heart attacks. But that is not to say that there are no group. There is also a group of people who would not have any symptom at all, and they suddenly have a heart attack. So that now leads to the other risk factors we should deal with. And some of them have been mentioned: obesity, cigarette smoking, excessive alcohol ingestion, diabetes and all that. Some patients high cholesterol, eating too much fat. Some patients can have all these symptoms conglomerating, coming together in them, and now increase their risk of having a heart attack. And they might not have chest pain. They might not have a warning sign. They might just go out one day, be doing their normal activities, and suddenly they have this severe pain and they go down. And if nothing is done immediately, they are gone. So there are people like that. But majority of people will have this pain, which will come with activity, which will subside with rest, and it is repetitive, is reproducible, and when that happens, you should go see doctors.
Okay. All right. You want to take us somewhere?
Yeah, Dr. Oladipo Fashion has been giving us some useful tips on what to do and how to, take care of our health, especially as it relates to cardiovascular diseases. And another feature from Uru here on coronary heart disease. Let's quickly get to see that before we continue the studio discussion with Dr. Fashion.
Coronary heart disease is usually caused by a buildup of fatty deposits on the walls of the arteries around the heart. In some cases, may be very noticeable, but one can have the disease and not have any symptoms. This is more often true in the early stages of the heart disease, also known as the silent killer.
Why people call it silent killer is that, one, the blood vessels that supply the heart keep blocking gradually. So when they are blocking, you may not know. When the plaques that block the blood vessels it starts slowly. So you will not have symptoms at any point in time. And of course, what that means is that if we are not having symptoms and suddenly the event happens at a point where the entire blood vessels is blocked, the person now go into a cardiac arrest. Those who have family history of the disease, you can't change your family tree. So if you have a family member, especially parents that have died from the disease, you are at risk. Now, of course, as we age, blood vessels keep narrowing, so that also could be an issue. Then there are other modifiable risk factors. Those who are on the side of weight, who has obesity, and those who eat food substances that are dangerous to the heart. And one of them is trans fatty acids. Trans fatty acids are what we call, in the big terms that we put it there, partially hydrogenated oils. Now what happens is that oil is in natural form, is very difficult to transport and is not used. But what happens is when you now add hydrogen to oil, they become solid and they are useful in terms of transportation and of course increased palatability. So you have these items in cakes, most of the margarines that are being used to bake cakes and things like that. And of course people who use some of this trans fatty acid for frying in fast food joint. And part of what the work we do in our organization, in collaboration with other organizations, is to see how we can eliminate trans fatty acids in the diet of Nigerians.
Tobacco smoking and long-term exposure to secondhand smoke and also eating diets high in saturated fats are among the contributing factors to the rising rate of coronary heart disease in Nigeria today.
Migration to urban setting is happening rapidly. Now this migration comes with behavioral change. Now what happens? The food that you were eating while you were in a certain location that you found it palatable, when you come into a town, you have new class of people, you have new associations, and they are telling you that it's the fast food that is the in thing in town. People invite you for events, they give you food that is already contain a lot of trans fatty acids. People invite you to an event, they give you food that contain a lot of salt. So that is what is actually responsible for the rising cost of this condition. Another thing is, because we are moving into locations where we are sitting down most of the time, so when you see that, what happened? Your blood vessels are not active. So you need to be active deliberately. As public care physicians, we are worried that we're having rising cases of coronary heart disease. Eat a lot of fruit and vegetables, especially green vegetables that offers you the opportunity to open your blood vessels. Any product you are eating, please look at the packaging.
look at the content. How much sugar does the product contain? How much refined sugar does the product contain? How much salt does the product contain? You have to find time for exercise. Now, deliberate exercise. People make it think that exercise is only for weight reduction. No. The fact that you are exercising, put your heart, it's like saying, my heart, please keep functioning actively. As a way of life, we should find time to do medical checkup as often as is practically possible, including seeing a cardiologist.
According to the latest WHO data published in 2020, the deaths due to coronary heart disease in Nigeria has reached a total of 61,374, or 4.14% of total deaths, ranking Nigeria 107th in the world.
All right, it's scary looking at numbers, rising up and rising up. But the good thing is, at the end of the day, the doctors still tell us there is hope. And I still have a doctor in the house, Dr. Oladipopo Fashion. And doctor, as we speak, messages are coming in. Let's quickly see this one. Someone says, okay, it didn't state where you're writing from, but I'll read the message straight up. Good morning, doctor and presenters. I want to, please, when you're writing, try to abbreviate less so we can understand you better. I think she actually means to say that, okay, doctors say a whole lot about prevention and restrictions in life. Doctor, please, there is only one life. When exactly, and how exactly do we begin to feed to ensure that our health is in order?
Okay, if I get that question right, nobody says you cannot eat. What we just advise is that you should eat healthily.
Okay.
And healthy eating should be imbibed very early in life, because we now know that someone said earlier that there is a plaque that is formed. We now know that those plaques don't form overnight. They form over very many years. And we also know that the processes that lead to them eventually can start as early as childhood, when a certain kind of cell, what we call foam cells, are formed in the vessels. And so we advise parents to start teaching their children to eat healthy. We now know that the rate of obesity, prevalence of obesity has gone up, and more so prevalence of obesity in children has gone up. And when you talk to parents, they say, don't worry, leave them, they will outgrow it. Not often.
It's a status symbol.
Yes,
my child is chubby. It's not fat though, it's chubby.
We should learn to teach them to eat healthy from childhood, because like I said, that process starts from that age. So if you see someone having a heart attack at 40, he didn't develop it at 40. That process started much earlier. So the culture of eating right, and eating right does not mean you cannot still eat many things.
That's the point.
It just says that everything you eat should be in moderation.
So I can take whatever I want, ice cream, but in moderation.
Because, for instance, if we talk about cholesterol has massive good sites in the body.
Okay.
Massive. We need it for many things. It only becomes a problem when it's above what is accepted as normal for a prolonged period. And that's when that deposit starts to happen. That's when the vessel starts to block. That's when it happens. The heart attack or the stroke can happen. So we won't say you cannot eat oil, for instance, but we say reduce the quantity. Because also you need a full range of nutrients to have a healthy, every healthy body. To be healthy, you need a full range of nutrients. So if someone says don't eat oil, don't eat this, don't eat that, it doesn't make sense. And two, in terms of hypertension, for instance, we will never say you cannot eat salt, because you need salt for basic day-to-day functioning. If you see people with low salt in their blood, the way they behave, they can convulse, they can start talking irrationally. So we only say cut down the quantity of salt. Don't add salt on the table. When you are buying food, look out for the salt content of the food. When you are preparing your food at home, don't add too much salt. But it doesn't mean you shouldn't use salt at all.
Some people
Nobody
will say
says
if you
that.
don't cook the salt, it's more dangerous. When you cook it doesn't matter.
There is no difference. Salt is salt.
Okay, doctor, with this alarming rate of cardiovascular diseases, that is, many people developing this disease, what are the chances of survival when you have contacted the disease? And how can one now begin to live a normal life again after treatments? Are there treatments and all that?
Okay, so when you say cardiovascular disease, for instance, hypertension is a cardiovascular disease. It's also a risk factor for other cardiovascular diseases. And if you are diagnosed early, if you need medication, and you are placed on medication, and you take your medication regularly, and your medication controls because it's one thing to take the drug, the medication, it's another thing to get that blood pressure controlled. The whole aim of taking medication and doing lifestyle modification is to ensure blood pressure is controlled. So when you take medication, the whole idea is that you take medication, you check your blood pressure, and if the BP is not still controlled, go back to your doctor.
To change
because if you take the medication, BP is not controlled, the risk of stroke or heart attack or heart failure, kidney failure is still there. So take the medication, ensure BP is controlled, and live your life. As long as that happens, you will have done so much in reducing the risk of having strokes or heart attacks or heart failure or kidney failure or anything like that. So that's said. However, if you now have, by chance, God forbid, if you have a stroke or a heart attack or a kidney failure, now depending on which one and which part where you are at the time it happens and your knowledge base at the time it happens, it will determine whether you survive or not. What do I mean? If you have a heart attack now and you don't even know that you are having a heart attack and you don't show up until 2 days later when the person now becomes breathless, it's often a bit late. So that's why education is very important.
It's very key.
When people know, then they can take right decisions. People cannot take right decisions when they are less informed. So heart attack, for instance, has a window period we always talk about. And this window period is so short that if you don't get to the hospital within that period, the chances of being helped is markedly reduced.
Lizzie, I think you have some messages.
Yeah,
there.
plenty of them, and especially people are looking for free consultation. I'm not sure I'm going to be on that, but I'll take the very important one. Somebody wants to know what is the normal range for one's BP.
Okay, so
maybe you can bring it up with the age brackets.
Okay, so we don't use age brackets.
Okay.
We give absolute values, and this is what I would say to make it easy for everybody.
Okay.
The blood pressure we check at home, and we advise people to actually endeavor to have their own blood pressure monitors, the digital ones. If you check your blood pressure at home, what we want, what is good, is that your blood pressure should be lower than the top 135, lower than 135, and the bottom one should be lower than 85 if you do it at home. The top should be less than 135 and the bottom should be lower than 85.
Okay.
But when we do it in the hospital, the value we use is 140, so it should be less than 140 and less than 90 in the hospital. That's what we use. But if you check your blood pressure at home, and we advise at home, which is your natural environment, because there are factors that affect blood pressure when you come to the hospital, which makes it a bit difficult sometimes to determine if somebody has high blood pressure, but that's a different topic. If you do it at home, the top one should be less than 135 and the bottom one should be less than 85.
Okay. Now, in doing it at home, what are the relevant things we should take, notice of, like the position of the hand?
Lovely.
Are we talking when we are doing it?
Great question. So
okay.
There is a way we advise people to check blood pressure. Usually, when you want to check your blood pressure at home, you should not have done any major physical activity within 30 minutes of checking their blood pressure. You should not have taken any stimulants, you should not have taken coffee or anything like that. Preferably the AC, if you have an AC in in your house should not be on because we don't want it to be too cold and we don't want it to be too hot. The ambient temperature should just be okay. The TV should be off if there's a TV around, because we don't want, while you are checking blood pressure, they show you something that gets you agitated and might affect your blood pressure. And when you've done all that, then you get your BP monitor, the SPIG, you wrap it around the arm. Again, you should note, for different people have different body sizes. You should get one that the cuff is adequate.
Can go round.
Yes, for your arm circumference. So when you wrap it around, you should look for a good table and a chair, because what we want is your arm should be at your heart level and rested. You should not be holding your hand up or down or like this when you are doing it. It should be totally rested. Your muscles are not contracting. So you need a table, preferably a table that is like at your heart level. So sometimes say if you have a dining table in your house, just go to the dining area, sit on the chair, put your arm on the table, wrap your cuff round and rest. Your back rested, your feet rested, not crossed, separated, both on the floor, not hanging in the air, and then you press the machine.
Okay.
At the end of the day, I think it's better I just go to hospital.
Exactly.
The rules are so long.
I was just thinking about
that. Thank you for
coming.
You're very correct. Thank you for coming on the show. And I think it's time to say goodbye.
Yeah, thank you very much, Doctor.
Thanks for having me.
Okay.
All right, we've been speaking with Dr. Ola Dipopo Fason, the cardiologist here in National Hospital, and we had a whole lot of lecture. But I'm going to keep you standing by somewhere because we need to continue this lecture. Consultation, free consultations. Right about now, we'll take a break. When we come back, the show continues.
The topic for today, that is silent killers, and we have someone in the house that will still talk more about that. We have Dr. Yahaya Vatsa, Acting Executive Secretary, Primary Healthcare Board of the FCT. Thank you for joining us on the program.
Thank you. Good morning, Nigerians.
Yeah. Okay, we're talking about silent killers. Some of these diseases, diabetes, high blood pressure, and the rest of them. As someone in the primary health care, what is your perspective to these killer diseases as relates to Nigeria healthcare?
Thank you very much. Just as you mentioned, we have three tiers of healthcare in Nigeria, just like as it is in other countries: primary, secondary, and tertiary. At the primary healthcare level, we provide essential services that is affordable, available, and culturally sensitive, and technologically acceptable to the community. With community participation, communities are involved in active provision of the service. There's a link between primary care and the community. And at that level, we provide very critical and very essential services that will give people confidence in the health system. And that's what we are doing in FCT at the primary care level. And talking about this killer disease, hypertension, diabetes, and host of others, at that level we screen. Every patient that comes to the facility must be checked for those killer diseases. Anyone who said this killer disease, these are diseases that ordinarily people don't even see them. It's not like a wound on your skin that you can monitor whether it's healing or it is increasing or it is growing fast, bigger or so. You have to check. And checking here are very basic. What are the basic things? When you want to check for blood pressure, you just go and tie your hand and they check your blood pressure. But there is also one thing about checking blood pressure. When you are checking blood pressure, you don't just check the first reading and alarm the patient. Because sometimes when the patient goes to the facility, he is even worried what is his condition. He's sick, he has fever, and he has gone to check. And a doctor, a nurse, or a health worker is coming to tie his or her hand to check. The first thing you'll be thinking, I hope I'm okay. What is this person going to do? He will even be worried. If you are not careful at that stage, the blood pressure might even shoot up. So you tell the person, check, sit down. If the blood pressure is high, even at the first reading, tell the person, just relax. After about 5-10 minutes, recheck. It may come back to normal. because you also at that level don't misdiagnose. If you give wrong diagnosis and wrong label to a patient, you might even be contributing to more problem for the patient. So it's very important at that level that we do basic things.
Okay, so now, doctor, without meaning to cut it short,
Yes.
I picking up on what you said. We need to check.
Yeah.
And then, of course, your colleague who earlier on talked with us talked about lifestyle. And with you, I want to dwell a little bit more on our sleep habits. You people call it sleep hygiene, right? And then if the hygiene is not tidied up, there is a lot of consequences, including sleep apnea. You're going to comment on that for us, but let's quickly take a feature first and then come back and speak with the doctor. Sleep apnea.
Sleeping well keeps the body healthy and productive. It is therefore very important to understand the benefits of a healthy sleep and how to overcome challenges such as sleep apnea.
Sleep apnea is a severe sleep disorder that is associated with breathing repeatedly being stops and starts. What I mean is, you're sleeping, suddenly your airway is constricted. I mean, become narrowed. There will be reduced oxygen going into your system. From there, you feel like you're choking up. So what happens is your body sends a message to your brain to tell your brain you're not getting enough air. The brain will send a message to the body to wake up. Some people will wake up for a few seconds. They won't even know they wake up. Some people will just choke, and some people just snore. Snoring is another way of adapting to a way of not getting enough air.
The internal body clock regulates our sleep cycle, controlling when we feel tired and ready for bed, and when we feel refreshed and alert. Any obstruction to this cycle, like sleep apnea can bring about, can be very harmful to our body.
Risk factors to sleep apnea. The mild sleep apnea is you cut your weight, you reduce or stop smoking and drinking, and you treat hypertension, congestive heart failure, Parkinson's disease. That is treated for mild sleep apnea. If you're talking of moderate to severe sleep apnea, there's a machine they call CPAP. CPAP. Control positive air pressure. What this machine does is to help in dilating your airway. They put a pressure on your airway, dilate it, so the oxygen circulation can be effective and easy. Then the last stage of treatment, the severe one, is the surgery. Some people can get it from their family. Actually, it's not every condition that is genetic. It can be of your lifestyle. You didn't manage your lifestyle, that are acquired, and genetic factors can cause it.
According to experts, sleep apnea makes normal restorative sleep impossible, causing severe daytime drowsiness, fatigue, and irritability. It can also cause loss of concentration at work or while driving.
Excessive weight, people that are big, obese, men, ratio 3:1 compared to women, old age, family history, people with thick neck circumference, big neck, people with narrow airways. We have obstructive sleep apnea. From the word obstructive, obstruction. It means something is obstructing your airway from the tongue, the throat, and the soft palate. There's something we call central sleep apnea. From the word central, from the brain. It means the problem is coming from the brain. People with stroke may have sleep apnea, age and gender. And the last one is called complex sleep apnea syndrome. This is a combination of both obstructive sleep apnea and the central sleep apnea. Anything that will affect your muscles of your airway, will cause sleep apnea. Anything that will affect how it functions very well, it will cause sleep apnea.
Experts have advised that loud snoring can indicate a potentially serious problem, but not everyone who has sleep apnea snores. And not everyone who snores has sleep apnea. Hence, see a doctor if you have signs or symptoms of sleep apnea or any other sleep problem that leaves you fatigued, sleepy, and irritable. You must do all you can to avoid sleep apnea or any other sleep disorder, as it is commonly said that a good laugh and a long sleep are the best cures in the doctor's book.
Beyond the sleep apnea issue around sleep, what are other things that we can get, in terms of talking about silent killers, lack of sleep or sufficient sleep, can it affect our, health?
Of course.
In what ways?
Even your reasoning capacity. If you don't sleep well, you don't reason well, you are not even, you won't be alert, you won't be you will even be irritable. And even your blood pressure can actually go up.
Oh, okay.
And then it can affect the other endocrine system. And sleep is very important. Otherwise, God will not have given us that opportunity to sleep. You can imagine if you don't sleep, what will you even be doing with your time?
Pressing phone.
And then when you don't sleep well, your imagination will not be perfect. Your intellectual capacity will not be sharp. Of course, when I knew I was coming for this program last night, I slept very early. And I woke up early. In fact, before I came in, I slept for about 20-30 minutes. I said, let me be fresh.
That's beautiful.
When people come and their BP, the blood pressure goes up, it's one of the things they prescribe at that level. Look, go and rest.
Okay. Chief executives think...
Sometimes they will even tell you, off your phone.
Yeah.
Or if you don't want to off your phone, you don't want to miss calls, put it on silent, sleep. When you wake up, you see missed call, you call. But if you keep yourself awake, one day you will not be alive to
do that work. Okay.
Yeah.
In a situation where people think they can't get what they actually need at those primary healthcare facilities, won't they go for secondary or tertiary healthcare services?
We know over the years, these facilities have passed through some level of decay, negligence, and what have you, because of competing needs for the various government at different levels. But what this government has done is to ensure that the gap that is being identified at that level is addressed by ensuring that at every ward, political ward in Nigeria, I'm sure you are from the ward. If you participate in elections, you know most definitely that belong to a ward. In every single ward in Nigeria today, we are expected to have one functional primary health care. And FCT is there. And of course, the gaps, there was a gap analysis that was done to identify what are those problems. Is it infrastructure? Is it equipment? Is it human resources? And what have you? And then this scorecard, money is given from federal government through different gateways. In fact, two major gateways. National Primary Health Care to the State Primary Health Care Board, and then State National Health Insurance Scheme. In fact, today now it's called National Health Insurance Authority to State Insurance Scheme to the facilities. This money is used to actually correct some of the abnormalities of the gaps in those facilities. So if you visit those facilities in each ward today, you'll be happy you are in a facility.
There's a lot of change.
Yes, a lot of changes.
For in case of diseases that could not be handled at the primary healthcare level, is there any link with secondary health care?
Of course, that's a referral.
That's
a referral.
As a kind of referral.
In FCT, we actually we have almost concluded developing package for referral. It's a two-way referral. At that level, the health workers at that level, at primary care level, are actually guided by certain rules. By their training, they know that they should know the limitation of what they should be able to do at that level. Any situation, any condition that they feel is above their level, they refer to
the secondary.
And even on the referral note, it is expected on their way back, there should be a feedback, because the patient might have to be managed at that level again when you come back.
Definitely.
Using the routine drugs and whatever.
Still talking about silent killers, and Dr. Isa Yahaya has been in the studio discussing the issues with us, especially as it affects primary health care. Thank you very much, Dr. Yahaya, for being with us.
Definitely, we'll see you again tomorrow, and then we'll talk about what happened today. We continue, right?
Yeah, very well.
All right, so I'll see you tomorrow. Bye.
Bye.